Dialyze Direct brings more effective and gentler dialysis to the geriatric population. In the traditional model, the patient is brought away from the skilled nursing facility and in general tends to miss meals, tends to miss rehabilitation, and from a quality of life point of view, social activities and anything else that the patient gets joy from.
These patients keep coming back to the hospital, which the root cause is the fluid overload.
And 3 times a week dialysis, you can see the vicious circle because there's not enough time to remove all that fluid.
This is something that's real challenging for the nursing home when they are being judged by re-hospitalizations.
Dialyze Direct has repurposed home dialysis therapies to bring them to the skilled nursing facilities.
We remove a lot less fluid, but we do it much more often. Doing it much more often allows the dialysis session to be much more comfortable, much more tolerable, and gives back life and meaning to the patient.
Because it's 5 times a week, those patients will generally be normotensive over time. Their blood pressures will be normal.
Recovery time, and it's research-based, is approximately 30 minutes. So our patients, even those that are geriatric population, are able to engage in the activities that anyone else would who's living in the skilled nursing home.
They're able to go to lunch, go to the dining room, go to activities or therapy. They're not exhausted.
Just talking to the physical therapist, the patients are progressing leaps and bounds doing this type of therapy as opposed to the conventional therapy.
It makes a very big difference in the way that the residents feel about not just their day, but their partners, their family at the skilled nursing facility.
When a patient comes to Dialyze Direct at the nursing home, that nephrologist continues to see the patient. They continue to write their prescription and take care of the patient.
We will credential the nephrologist, bring them into our system.
When we collaborate with the skilled nursing home, we perform the dialysis. We will start the treatment, end the treatment, we manage the treatment, we manage the medications.
The whole of what we do is much larger than the individual parts. This is an entire model of care that involves coordination of care between our entire staff, which includes registered nurses, which includes experienced nursing caregivers, which includes dietary support, which includes social worker support.
That helps the patient to be stabilized and have a better chance to avoid re-hospitalization in the post-acute care 90 days window.
Now the hospitals really have learned to lean on us, and even some of the outpatient dialysis clinics, they have called us and they've said, hey, we've got a patient, that patient's not stable enough for us to dialyze them. Can we send them to you and you provide services, and then when they're stronger, they can come back to us when they go home.
Dialyze Direct provides a turnkey solution for nursing homes. Once we meet and we see a room, within 48 hours, you get a full booklet that will show you how the room will look like in operation. We take care of the implementation, and our nurses and our clinical team will work with your clinical team to educate you about what we do and how we can provide better care with better outcome for these patients. We provide you a full marketing solution, and we go with you to the hospitals and deal with the payers in order to maximize the impact of your program.
Dialyze Direct has done everything that they said they would do. They have been very helpful in reaching out to hospitals, case managers, touring hospitals, meeting with the nursing staff, and providing direct information to the local nephrology groups.
As we continue to expand across the country, Dialyze Direct is providing our partners the unique opportunity to successfully add this specialty to the skilled nursing facilities. Contact us at dialyzedirect.com.